Hello, my name is Corey Shapiro, and I'm one of the nurse practitioners here at the Clearwater Free Clinic. Today, I want to talk to you about blood pressure and why monitoring for high blood pressure is important. Blood pressure is the amount of pressure exerted on the inside of your arteries with each heartbeat. Blood pressure is measured in millimeters of mercury, and a normal blood pressure is less than 120 over 80 millimeters of mercury. At this range, your body is able to perfuse your distal tissues with oxygen-rich blood. Blood pressure fluctuates throughout the day based on a variety of different factors. However, long-term elevated blood pressure can lead to additional or worsening chronic health conditions and can put you at increased risk for heart failure, arrhythmia, heart attack, stroke, kidney failure, vision loss, or even death. It is important to monitor yourself for the silent killer, as this condition rarely presents with signs or symptoms. Blood pressure is often elevated. In fact, nearly half of all Americans suffer from high blood pressure, otherwise known as hypertension, and only 1 in 4 have their blood pressure under control. In terms of causes for hypertension, there are things that you can modify and things you can't. Obesity, a BMI greater than 30, a sedentary lifestyle, a high sodium diet, alcohol use, tobacco use, and even anxiety are all factors that can worsen hypertension and things you can sometimes control. Things you can't control are genetics, chronic kidney disease, and other pre-existing medical conditions. Hypertension can be broken down into 3 stages: pre-hypertension, stage 1 hypertension, or stage 2 hypertension. I'm sure you're wondering, how can I tell if I have hypertension? If you have a blood pressure cuff at home, you can take these simple steps to ensure an accurate reading. Just be sure to read the instructions on your machine prior to cycling. Sit calmly for at least 5 minutes with both feet flat on the floor, cycle your cuff, and record your reading. Monitoring your blood pressure is important regardless of whether you are on treatment for hypertension or not. If you're diagnosed with hypertension, there are many treatment options available. In fact, there are 2 treatment options that don't require any medications, and that's adhering to a healthy diet and lifestyle, which includes a low sodium diet. Losing just 2 pounds can reduce your blood pressure by about 1 to 2 millimeters of mercury. And adhering to a low sodium diet, no more than 2 grams of sodium per day, can also reduce your blood pressure by about 3 to 5 millimeters of mercury. So if your blood pressure is 130 over 80, you lose 2 pounds and stick to a low sodium diet of no more than 2 grams of sodium per day, you can reduce your blood pressure to a near normal range without any medications. If you're placed on medications to help control your blood pressure, it's important that you monitor yourself at home on a regular basis. Lastly, if you use tobacco products, quitting will further reduce your risk of heart attack or stroke, amongst many other adverse health outcomes. Thank you for listening, and be sure to speak to your healthcare provider if you have concerns that you might have hypertension.